Hi, everyone. Thank you so much for joining us today. I'm Sarah Miller. I'm the executive director of the American Economic Liberties Project. Today's discussion is going to focus on the insulin industry, which, as I'm sure most of you know watching this today, is controlled by three big players, Sanofi, Novo Nordisk, and Eli Lilly, who've been raising prices in lockstep for years with no real accountability. This creates obviously financial instability for patients and their families, inhibits quality of life, and costs lives when patients can't afford their insulin, with a disproportionate impact on Black and Brown communities. It is also indicative of what we see as chronic lawlessness that large corporations tend to enjoy, and the dormancy of powerful federal regulators and enforcers who are tasked with preventing both monopolization and consumer abuse, but instead have generally permitted it, particularly in this space. We launched last week the Investigate Insulin Now campaign with more than 40 amazing partners, some of them which you'll hear from on the panel in a few minutes, to demand that the FTC open a cartel case against the big three insulin manufacturers. You can find out more about that at investigateinsulinnow.com, sign the petition, share your story. We've already got hundreds of people who have done so. So a lot of energy, I think, behind this idea, which is so encouraging. We're also really encouraged by what seems to be a likely turning of the page by the Biden administration and break with the more passive approach of the past on these issues. And we're especially encouraged by the growing cohort of leaders in Congress who aren't only committed to using their own power to hold dominant corporations accountable, but also engaging in robust oversight of relevant federal agencies. Congresswoman Katie Porter has been holding powerful corporations accountable long before she won her seat in Congress and quickly established herself as a force to be reckoned with in the time since. When the COVID-19 pandemic began, she used her famously tough questioning skills and her whiteboard to secure a commitment from the Trump administration that COVID-19 testing would be free. And if you haven't, I encourage you all to read her recent drug report called Killer Profits: How Big Pharma Takeovers Destroy Innovation and Harm Patients, which showed how consolidation in the pharmaceutical industry harms everyone except those lining their pockets. Thank you so much, Congressman, for joining us. I know you only have a few minutes before you have to get back to work. The floor is yours.
Thank you so much. Thank you to the amazing team at American Economic Liberties Project for organizing in this event. And thank you, Sarah, and every single person on this call for your work on these issues. The pandemic has obviously highlighted the broken pieces of our healthcare system, but let's not make excuses. Long before COVID-19 began to take lives and infect people, our healthcare system had serious problems that were killing patients. And I was working on these issues before, and I'm going to work on them after we defeat COVID-19. Today, we're here to talk about one of my favorite targets, Big Pharma. I hear it all the time from families. You do too, and some of you experience it in your own lives. The cost of prescription drugs is too high. This rings true across the country. We all know the statistics. 1 in 5 Americans are skipping a dose. 1 in 4 Americans are not filling prescriptions. And meanwhile, Big Pharma's profits are higher than ever. One study found that pharma would still be the most profitable industry in the country, even if it lost $1 trillion in sales. This is an industry that is deeply broken and that is deeply anti-competitive. Anyone who has ever purchased a car can tell you that shopping and negotiation are central parts of the process. They are central to what it means to be a market and to have capitalist economy. So price transparency, competition, consumer choice, information, these are all fundamentals without which we cannot have a functioning capitalist market. And by any metric of a healthy market, the prescription drug industry is failing. There is zero transparency. When you go to the pharmacist to pick up your medicine, you never know what it will cost. They don't even have to tell you if it would be cheaper for you not to use your insurance than to use your insurance. And there's little consumer choice, as companies have done everything possible to keep competitors off the market, created complicated formulary lists that are ever changing even after you purchase your insurance, and they have instituted policies that only compound these problems. Finally, pharmaceutical companies have little incentive to invest in innovative new medicine without the threat of competition. And my office, as Sarah mentioned, recently conducted an investigation into competition in this sector. My healthcare staffer, Jessica Siegel, is amazing. And what she discovered doing part of this research is something that probably won't shock anyone here today, which is that competition is virtually non-existent. Instead, big pharma companies are free to devote their considerable resources to merging with or acquiring companies that would otherwise force them to compete. And this consolidation is destroying scientific cultures that once celebrated creativity and instead transforming them into places that are focused only on the needs, and I put needs here in quotes, the needs of short-sighted shareholders. And because they can do this, most large companies focus on small incremental changes to existing drugs in order to kill off generic threats to their government-granted monopoly patents. Those patents belong to us. They are a gift from the American people. And when they cease to serve us, we need to revisit them. And what drug companies do is they make these incremental changes, as we all know, rather than producing breakthrough life-saving drugs for diseases with few or no cures, or make real innovations that would save lives. And they call these indications. They help them, these small changes, and they help them secure additional patents. And in their words, in the words that they come to Congress, they help them protect their investments. But in reality, these investments are those of academic researchers, of small biotechnology companies, and of American taxpayers. And big pharma companies do acquire small pharmaceutical companies, but they do it after they've discovered a breakthrough drug, after millions of dollars in taxpayer-funded research and venture capital is poured into those risky initial stages. The point at which a drug or early concept may fail, the big companies are never there. So these investments that they make when they acquire the small firms are very, very safe. They know that there's blockbuster research that will make them even more money. And trust me, there are incredibly few exceptions. Pharmacy has gained a lot of goodwill with the rapid breakthroughs that we've seen in response to the COVID-19 pandemic. But without taxpayer-funded research, we would not have these signs of hope. Companies with billions in profits rely on our dollars to support their research, unwilling to assume the risk themselves. My office's report shatters this argument that drug companies need to keep prices high because they're spending so much on research. We knew this wasn't true before, but now it's even weaker. The insulin industry is one of the worst offenders there. As Sarah mentioned, just 3 companies, Eli Lilly, Sanofi, and Novo Nordisk, control nearly 100% of the US insulin supply. And together, these companies have exploited their market power, keeping diabetic patients from getting affordable insulin. They continue to raise prices in tandem, often on the same day. The average list price of insulin increased 11% annually in the last 17 years. And if these trends continue, gross insulin costs in the US could reach $121 billion in total spending. That's more than $12,000 per patient. And we're not going to get there in several decades. We're going to get there in a couple years. And the realities of these numbers are appalling. As many as 1 in 4 people can't afford their insulin, so they ration it out or they starve themselves so as to need less insulin. At least 13 Americans have died from insulin rationing in recent years. These are unnecessary deaths caused by the ever-growing price of a drug that was first patented nearly 100 years ago. The effects are so much worse for patients of color. Structural inequities in our healthcare system have led to a higher incidence of diabetes among Black Americans, and the price of insulin exacerbates that inequality. Black patients with diabetes also have less access to insulin. ProPublica recently wrote of an epidemic of amputations among Black Americans, an epidemic of amputations in the richest country in the world, in America. An epidemic largely caused by exorbitant insulin prices. And the big 3 manufacturers' lock on the government doesn't just hurt patients, it hurts all of us. It increases government spending. And one study examining reimbursements from 1991 to 2015 from Medicare and Medicaid found a near exponential upward trend in Medicaid patients on a per unit basis for a wide variety of insulin products, regardless of formulation, duration of action, and whether the product was patented. Insulin prices are going up, not just innovative insulin, all insulin is going up, and it's going up in lockstep in large part because of a broken market. And the extreme cost of insulin is not a worldwide phenomenon. It's occurring here. It's specific to the US. We as Americans pay far more for insulin and out-of-pocket costs than any other country. It's a uniquely American phenomenon that patients with diabetes are regularly forced to ration insulin and risk death. This isn't a coincidence that this is happening in America. It is a result of failed policies. So what can we do to fix this? Our office's report has several solutions, and I'm so proud of the work that the American Economic Liberties Project is doing to identify even more. First, many experts see that large pharma companies' efforts to satisfy investor and shareholder desire for growth as the primary cause of the post-M&A, post-merger innovation drop. From a financial perspective, funders of pharmaceutical businesses don't generally have the 20-year perspective that is required to translate bioscience ideas into market-based products. So we recommend that companies be banned from being able to tie bonuses to financial metrics, but instead link executive bonuses, which are very, very large, to either measures of health outcomes, such as reduced symptoms or mortality, or tie bonuses to the revenue that that company is reinvesting in research and development of new drugs. And if companies won't take these actions on their own, then we Congress have to consider tying these requirements to merger approvals, patent exclusivity grants, and other mechanisms. Beyond this, the Federal Trade Commission, the FTC, must evaluate and push back against pharmaceutical companies' various anti-competitive behaviors. The FTC needs to stand up and stop harmful healthcare industry mergers. They need to go back and review past mergers to see if the promises made in merger agreements were met, or if anti-competitive behavior in fact grew or changed after the merger. And after looking back at these past mergers, the FTC must decide if these agreements have been upheld, and if not, whether these companies should then be broken up. I also recommend and advocate for the FTC reevaluating the standards they are using for healthcare mergers going forward, in light of the information that they're going to learn from looking back at the consequences of past mergers. Going forward, the FTC should incorporate merger review anti-competitive conduct as part of the assessment into whether or not the merger will be anti-competitive. If in the past your mergers have resulted in anti-competitive outcomes, we ought to take that into consideration in evaluating your promises in your pending merger applications. And this anti-competitive behavior we ought to be looking at should include, but not be limited to, things that economic liberties projects are fighting against: pay for delay schemes, abuse of the Orphan Drug Act, patent thickets, evergreening. So I was really excited to see the FTC begin to work on this earlier this week. The FTC and its counterpart, competition enforcement agencies in the US and abroad, announced this week that they're launching a working group to update their approach to analyzing the effects of pharmaceutical mergers. We have to make sure we are the loudest voice that speaks out to this working group and helps them see the very real, very human costs of what happens when pharmaceutical companies are allowed to engage in anti-competitive behavior. Finally, Congress, we have to pass legislation that creates barriers to skyrocketing costs. It's not enough for politicians to run on this issue. We have to deliver on it for the American people. And so this begins with drug price negotiation legislation. And we had HR 3 last Congress. There's an opportunity to strengthen HR 3 to make it much more robust. And we have to continue doing that work, making sure that it extends to a larger class of drugs and covering all payers and the uninsured, not just Medicare. So beyond negotiating a better deal for American consumers with drug pricing legislation, we in Congress also have to be ready to pass legislation to prevent anti-competitive abuses of the drug patent system. The prescription drug market in this country is broken, but it is not irretrievably so. It is broken because of a consequence of policy choices, lobbying by big pharma, and the lack of enough pushback from American patients. And so what the Economic Liberties Project is doing here, what all of you on this call are doing, is coming together, and together, raising our voices, we can stop the rampant waste, the abuse, the patient harm, the needless deaths that are being created by this system. So I'm so grateful for the work that you're doing, and I look forward to continuing to work with you. I just want to close with a personal story. I recently had delivered to my doorstep a small blue vial, kind of a pill-sized bottle, blue glass bottle, and inside were a pair of earrings. A pair of earrings, each earring was an insulin bottle. And the patient who put this on my doorstep left a note saying that these insulin earrings were likely to be the most expensive jewelry that I owned. And she was right, given the cost of what was in each of those vials. So I wish I had worn them today so that I could show you all just how much the cost of insulin is bringing harm and pain to American patients. But I want to say thank you to this diabetic who left me those earrings, who left me that tangible reminder of the incredible rising costs of insulin and the harm that it creates to her and patients in our country each and every day. Thank you so much for letting me join you today, and please keep up the good work.
Thank you so much, Congresswoman. You know, I think that the way that you wield power, essentially, we hope that it is contagious. We are so inspired by it, particularly on this issue where the life and death consequences are so clear and the injustice is so evident, and the problem has been so chronic for so long. I think, you know, we are hopeful that now is a moment where we can start to instigate real change, both through agency authority, which you laid out so clearly and helpfully, and through action in Congress. So thank you so much for your time. We know you have a hearing to get to, so we will let you switch Zoom calls, but look forward to continuing to work together, and thanks so much for your leadership.
Absolutely. Thank you for all your hard work, and I'm really proud to be your ally in this fight. Thank you.
All right, I want to turn it over now to Matt Dinger. Matt Dinger is a patient. He's an insulin advocate. He's a healthcare technology executive, and he's a member of T1 International's board. So we want to give him a little bit of time to both share his personal story and perspective. He's a longtime leader on these issues, and then we will turn it over to our panel. Thank you so much, Matt, for your collaboration, for sharing your perspective, and for joining us today.
Yeah, thank you, Sarah. Thank you, Congresswoman Porter. And thank you all for being here. Your allyship here is inspiring. As a patient with diabetes, you feel alone a lot of the time. And it's wonderful to be virtually surrounded by people who are eager to listen and to act. The power of this movement is really that we are coming together. My name is Matt Dinger. I am here today representing T1 International. It's 38 growing Insulin for All chapters, as a member of the Board of Trustees and a proud patient with type 1 diabetes. Another patient with diabetes my age died from rationing insulin last year in a city 30 miles from my home. He died alone in a garage he was renting, as his family was unaware that he had lost insurance coverage. I wish I could say that I don't know how something like that can happen in the United States, but unfortunately, I know exactly how it can happen. It could happen to anyone who needs insulin to survive. Over 90% of the global insulin market and nearly 100% of the US market is dominated by 3 corporations: Eli Lilly, Novo Nordisk, and Sanofi. These companies have a well-established record of cartel-like behavior, frequently raising prices within days or even hours of each other in search of higher and higher profits, no matter the impact on patients. And that impact is massive. A 2018 survey by T1 International revealed that over 1/4 of patients with diabetes in the United States rationed their insulin in the previous year. And evidence suggests that cost is only increasing as a barrier. I personally don't know a single diabetic who has not rationed insulin at one point or another. At the end of last year, I changed jobs, and as a result, I was uninsured for a month. Luckily, I had time to prepare for this, so I made sure I filled a 3-month supply of insulin, something that many people aren't allowed to do depending on their insurance. I researched the rules for COBRA in my state to make sure that I could retroactively apply for it if something catastrophic happened. I signed that paperwork and put it in a place where my partner could access it so he could submit it if I became incapacitated. Even when I did receive insurance, I avoided getting insulin until January because I had a new deductible to meet. So my out-of-pocket insulin costs would have been about $1,000 a month. I rationed my insulin. Even in the place of privilege I occupy, these are the things that I had to do in order to stay alive and secure my family's financial future as an insulin-dependent diabetic. And that was 1 month. I'm lucky to be in the position that I'm in. And even so, I'm a job loss away from financial ruin because the concentration of economic power when it comes to the price of insulin lies almost entirely in the hands of 3 companies. I am completely beholden to them, and I'm terrified by that every single day. Corporate concentration and monopolistic behavior by the big 3 insulin manufacturers allow them to set prices as high as possible with no fear of losing market share. This includes things like shadow pricing, which is increasing the prices in tandem with one another instead of competing to set the lowest price, pay for delay agreements, lawsuits to keep biosimilar insulins off the market, patent games to extend their product exclusivities long past when they would normally expire. As someone who has worked in healthcare for the entirety of my professional life, I understand the price of innovation. And let me tell you, leveraging anti-competitive practices in order to give your CEO a pay package of $23.7 million isn't innovative. And businesses that would do that while their consumers are dying aren't companies, they're cartels. The concentration of economic power is way out of balance here. And for now, there's no counterbalancing force to protect patients from being exploited for the insulin we rely on every day just to stay alive. While there are legislative proposals on the table to lower the price of insulin for many or all people, we need a both-and approach that includes the Federal Trade Commission stepping in as soon as possible to investigate the problems with the insulin industry and take action to rectify them. In short, those of us that use insulin are not being protected from unfair, deceptive, and anti-competitive practices in the insulin marketplace. And beyond the thousands of dollars each year we pay for insulin, the true cost of putting up with these practices is quite literally our lives. So thank you for joining in this fight to ensure that Congress and the FTC hold these corporations accountable. And with that, I'll turn it over to Olivia for today's panel.
Thank you so much, Matt. And thank you, Sarah and Congresswoman Porter. It was equal parts stirring and wonky, which is my favorite. I am going to introduce our panel. We have Maurice B.P. Weeks, the co-executive director of the Action Center on Race and the Economy, also known as ACRE. We have Tahir Amin, the co-founder and co-executive director of IMAC. We have Laura Marston, an attorney, longtime insulin advocate, and one of my favorite people on Twitter. And we have Alex Lawson, the executive director of Social Security Works. So I want to start by picking up where they left off. Just 3 corporations control almost the entire insulin market. Has it always been like this? And how did we get to this point? And I'm going to start with Alex here, but feel free to go around if you have things to add.
First off, just thank you. It's a real honor to be here amongst all of these amazing folks who are in this fight. The answer is sort of in the middle. It has not always been this way. That's the shortest answer. We've seen a rapid acceleration of the sociopathic price increases that these three companies illegally perpetrate on people since around 2000. If you go all the way back 100 years, you have these scientists, these doctors who discovered this life-saving the formula, and they gave it away, $3. But they made one of the biggest mistakes you can make when you're trying to increase access. Only slightly less well known is giving something that you want access to an American company and allowing them to patent it, which is what these scientists did when they gave it to Lilly way back in the day. They gave them the ability to patent further work on it. And as early as 1941, you're seeing actually cartelism in the insulin market. And there was a case brought against Lilly, and then basically the proto other companies, what became the same three companies that dominate the market. But they were at least scared for a while of enforcement, even though that enforcement action didn't really crack on them. It was still a slap on the wrist. So they were scared, but then it just became apparent that the FTC just was not doing anything to anybody who was just openly and notoriously acting as a cartel to raise prices year after year, and that they blocking mergers that were clearly consolidating markets. And so corporate America just, decided, hey, no one's doing anything. All full speed ahead. We're going to raise prices until we find what the market will bear. And what that means here is when just a few people die from these prices, so that everyone else is terrified enough that they'll spend their last penny to afford the insulin that they need to survive. That, in this case, is what they mean, these executives, when they say what the market will bear. It's a body count that's on them. So we've seen corporations will always try to make as much money as possible, but when they're afraid that the government is going to actually crack down on them, there's something that holds it down. When they just figure they can operate with impunity, they actually will do what we've seen since 1980, and then again since 2000, it's really skyrocketed.
Yeah, and one of the things I want to emphasize that I think is important here is that the prices keep going up in lockstep. All three companies keep raising the prices, sometimes on the same day, indicating that they see what everyone else is doing and they feel free to just raise the prices on the same day. So I want to open it up to anyone on the panel. What does this mean for patients?
Well, just to bounce off what you just said, Olivia, in my opinion, and one of the reasons the FTC needs to step in here is it's more overt than following a competitor's price increase. There is an unlawful, illegal conspiracy going on where these companies are planning in advance for price increases so that they can do them in lockstep. And just to give everybody on the call a point of comparison. So I'm 38 years old. I was diagnosed type 1 when I was 14, so 24 years ago. And I have been on the exact same unchanged insulin, Humalog insulin, since 1996. It was released right about the same time as my diagnosis. And a single vial has gone up in price from $21 to over $275, just in the 24 years that I've had it. So what that means for me as a patient is, like Alex was saying, I live in constant fear. I have been without insurance. I have had to pay astronomical prices. I have had to watch my consumption. And to this day, I live in a very small apartment in DC, and half my fridge is what I call my insulin dregs vials that I keep, Ziploc baggies full of expired dregs of insulin in case these companies raise the prices more. Because as Alex said, and as others on this call have said, there has been no government intervention in what appears on its face to be prima facie price fixing among competitors. So that's why we need to pressure the FTC, and that's why they need to really issue subpoenas, conduct a full-scale investigation to find out what was happening.
Yeah, just to add a little bit on Humalog in particular, that's a medication that between 01 and 05, just to give a context, went up in price by 576%. So these aren't like little like day-to-day changes of 30 cents, 40 cents. This is an astronomical budget changing, life-threatening price increase. And I think part of why these companies aren't afraid of government intervention, if you look back at the last 4 years of the Trump administration, we really had a wolf in the henhouse with Alex Azar, who is a former executive from Eli Lilly, being the person who's overseeing HHS. And that's someone who was involved in this very medication that is, stripping wealth from patients, particularly Black and brown patients, but all lower income patients. And they're in a chief position to really be, investigating and cracking down on those very same companies. So yeah, like Laura and Alex are saying, it's well past time for to strike a little bit more fear into this cartel, this really illegal conspiracy cartel that exists.
Relatedly, this doesn't seem to be as much of a problem in other countries. Can we talk about why that is?
Who's gonna?
Go for it, Alex.
I can start on that one. It's because they do stuff, right? It's like oftentimes when this issue comes up, drug pricing, and we're looking at the insulin cartel, it's treated as like, it's rocket science. Oh, it's so complex. It's not complex, and it's not rocket science. The reason prices are lower in other countries is because the government's like, you can't kill people with your prices. No. And then the companies are like, all right, we'll lower our prices. And in America, we literally are like, there's nothing we can do right now. America is like, there's nothing we can do. What are we? Oh, look, my daughter is joining me. So the big difference between here and other countries is that we don't do things and they do.
Laura, do you want to add on?
Yeah, I'd add on to that. Just to give us a point of comparison, what costs $275 to $300 a vial here in the UK costs nothing to the patient, costs the NHS, the National Health Service in the UK, £16. The next most expensive country for insulin is Canada, in part because they use an international reference basket that includes the United States. So we're at part to blame for that. But even there, a vial of Humalog without a prescription will run you about $25 to $30 out of pocket. So we're talking 10 times that. And for another reference point, it costs approximately $2 to $5 to produce each vial of insulin. And inarguably, it has gotten cheaper over time. The insulin producers used to have to keep and kill livestock and get the insulin from them. It's now turned into, it's all done in vats in manufacturing facilities. It's literally almost like manufacturing beer. So think about if that next beer you want to have when you kick back, which as we all know is not essential for life. Well, what if that beer was, $500? Would you drink it? Well, no. Well, what if you didn't have a choice like me? And just to put it in perspective, I'm sitting here talking to you all, I feel great today. If I unhooked my insulin pump right now and did not have any insulin going into my body, I would be comatose within 8 hours about, and irreversibly so if no insulin was given to me. So I would probably die in about 2 days without insulin. And that's what these companies are taking advantage of. It's our imminent death without insulin and our fear thereof to financially strip us of everything we have.
And while we're talking about the cost to patients, I want to bring up a report that Maurice and his organization put out this year. We'll put it in the chat. It talks about how structural racism and prescription drug pricing and access affect Black and Hispanic patients. Insulin is obviously just one part of that. Maurice, do you want to talk more about that?
Sure. Yeah. I mean, I think the most important thing to realize here is that the pharmaceutical industry, like every single industry in America, isn't exempt from the racist aspects of American capitalism. So just as we, folks might look at the housing market and say, well, that's very clearly over history extracting wealth from Black and brown folks, and we can point to specific instances in history where that has been particularly true. The same is true of the pharmaceutical industry. So if you look at, we're talking about insulin here, obviously because of other structurally racist things in the country, Black and Latino folks are more likely to need insulin than other groups. And that's just based on lots of structural racism that has existed in this country since its founding. There's also lots of studies that show that those groups, because of increased levels of poverty, are the most likely to skip doses, ration doses, and end up dying from missing doses of insulin. So we have to wonder, on the other end, so you have Black and brown patients dying, and then on the other end of that, you have companies like Eli Lilly racking in $30 billion a year in profits, paying their executives hundreds of millions of dollars per year. So what better display of wealth extraction can you have of these communities that have been, really destroyed by American capitalism for so long, being really put to in life or death situations so that, pharma CEOs can make millions and millions, and their companies can make billions and billions of dollars. And I just want to add, of course, with insulin's the focus here. There's nothing, particularly about the formulation of insulin that makes it very easy to reprice. And pharmaceutical companies do this with lots of different medications. We in our report looked at medications that treat things like hypertension and heart disease and other things where because of structural issues in the country affect Black and brown folks. And you see the same types of patterns. And it really is a lack of government intervention and really strong anti-monopoly rulemaking that makes this the case and ends up with horrible, horrible outcomes for Black and brown communities.
Thank you. Yeah, now I want to talk about how they're holding on to this power, because they're obviously holding on to it. So Tahir, I want to bring you in. Can you talk more about the strategies that these companies use to maintain their hold on insulin?
Yes. I just wanted to sort of track back and just look at the developments that have happened in insulin. If we look at since the 1920s, when we had human insulin, and which was, pretty much freely available. And over the years, it's become more sort of synthesized in terms of recombinant DNA. And we've had this kind of more sort of taking nature and slightly tweaking it, taking out an amino sequence acid, and basically, hey, presto, you've got a whole new product. And sure, there are certain benefits with that. And some of this can be really traced back to which I'll talk to maybe a bit later, is really what happened in the 80s, and basically everything became patentable. And so this what brings us to the issue of patents. And if we look at some of the products on the market, like say Atlantis, which is something that my organization has studied, you're talking where the initial patent should have expired in 2015 for insulin glargine, and yet we have patents that were filed after the first approval, which was 2000, and essentially they run till potentially in total 37 years. So what remains then is companies have to litigate. And we haven't really had any real competition in the marketplace because these pen devices have been used to block competition coming into the marketplace. So the actual active ingredient is no longer under patent. But what these companies have done is they've kind of filed these extra patents of formulations, which really then get subsequently found invalidated, but usually delay competition coming in 3-4 years. So how many billions of dollars is that? And then you have these dispensers, which maybe, you know, they're dose adjusters or push mechanisms, which may help the patient in some ways, but subsequently then get invalidated. And we've got antitrust cases going on. And all this really adds up to the delay, and it holds the market power. And that's how they actually try to preserve their power. And we're seeing this already even with some of these sort of slightly newer versions of, you know, I'm probably going to butcher the name, but Lyumjev and Toujeo, these have all got patents that are running as far as 2035, 36. So this game is not ending. And I'm sure we'll discuss, you know, what can we do to solve these problems. But I think a lot of it does happen in the patent system that enables these corporations, like, you know, this cartel to hold on to power. And only Mylan has actually just broken in just last year with a sort of what we call a biosimilar product. And, you know, you think about the controversy surrounding Mylan and its EpiPen. This is all playing out in the insulin space. And so, you know, we really have to look at the sort of incentives that we're giving companies and how much we're giving away at the cost of patients.
How did the manufacturers justify this? Because it seems very obvious that they've taken a drug that was, you know, synthesized 100 years ago, is essential for life. How are they justifying the continual patents and then the price increases?
Well, I think as Congresswoman Porter said, you know, these incremental innovations, as they like to be called, and what they do is they tweak a slide to, they'll change the dose, or they'll add a device that says, oh, well, this makes it much easier for a patient to inject themselves. And sure, there may be some adherence benefits, but is it worth 20 years of another monopoly? And I think these are the greater questions we have to ask ourselves. And you know, we've spent a lot of time with the people in the patent office and speaking, and they'll say, well, you know, if the patients want this stuff, but at what cost? How much do they need to be incentivized to come up with a device? I think, you know, real market competition is where people say, well, my product's going to be better, so they'll come up with a newer product just to stay in the marketplace. This whole threat of, oh, we're going to, you know, remove our investment and not work in this space anymore is often really to say, well, we want more monopoly power, otherwise we're not going to play the game. And I think we've fallen for that. And so these are the games that are getting played in the patent system, and as a result, our institutions like the FTC haven't really been able to really hold them accountable, and Congress, unfortunately, despite its attempts and passing some laws to try and sort of bring some more transparency, really are only around the edges. So they're kind of more patent adjacent, but they're not actually dealing with the root.
Alex, I saw you unmute yourself. Yeah.
Yeah, just Tahir is absolutely correct. He does all the research. I just read his stuff and then regurgitate it. But I want to point out some stuff that's like a little bit more basic than just following the path. They don't justify themselves. They don't feel they have to. They just do it because they can, and they get away with it. It's the same. It's like asking why a criminal, you know, an organized crime, you know, robs and steals and does what they do, because that's what they do. They don't justify it. If they ever get caught up, they look at it as a PR problem and they just throw money at it. They buy politicians, they corrupt everything that they touch. If there is something that, you know, an entity that arises that's challenging their power, they'll either destroy it or corrupt it. That's what pharma does. So like thinking that they have some logical reasoning behind it, they don't. They know what they're doing. Right? They know 100% what they're doing. They have communications between themselves about what they're doing, charging prices that kill people because they can, because no one is telling them no. And you literally just have to look at other countries versus here to see that, right? The same company here has prices that lead to death, and in other countries they have prices that are, you know, somewhat reasonable because the government is acting. And I want to like circle one thing all the way back. Congresswoman Porter laid this out. A lot of people have talked about it. At the end of the day, I want to remind people that taxpayers actually pay for all the research and development that's going on. All the stuff that actually leads to the creation of new things is taxpayer funded. You might hear innovation You know, how do they justify things? Innovation. The pharmaceutical industry is amazing at innovation. They innovate every single day ways to extend their patents. But the last time that they actually came up with something that benefited the patients, I can't think of, because it's what Congresswoman Porter said. There are scientists doing a lot of amazing work, and it's with public dollars, taxpayer dollars. Like you look at the NIH vaccine right now, the mRNA vaccine, 100% paid for by taxpayer dollars, 100%. Moderna put in $0. Dolly Parton put in $1 million. That's 1 million more than Moderna, but it's called the Moderna vaccine. How do they justify that? They don't. They don't justify it. They act with impunity because there are no consequences. And I just want to really get that of why this is so important. Until the government acts and actually does their job, these companies will never change their behavior, ever.
Just to piggyback on, and Alex is exactly right. I think we have a system where it's, companies actually build into their strategy that they're going to get fined maybe $500 million for messing with the marketplace and abusing it, and that's okay for them because they're making billions elsewhere. And so our system is really incentivizing, stack all these patents up, do all these shenanigans, and then, maybe the FTC will slap them with a fine. They're happy to pay that. So really, we need to go behind all that and really get to the source of the problem, how we actually give them the power in the first place, because that's what's really driving a lot of this. And unfortunately, to date, the government hasn't been willing to do that.
Thank you all so much. I feel like we could go for another 2 hours, but I am going to cut us off so we have time to hear from Cameron Hall. Cameron is a nonprofit strategist, a patient himself, an insulin advocate, and a board member at T1 International. Thank you.
Yes, thank you, Olivia, and thank you to all of our panelists for this excellent discussion. I have lived with type 1 diabetes for 22 years. I was diagnosed at the age of 9 in 1999. And I have definitely felt the impact of seeing the rising cost of insulin throughout that time. As someone who has utilized insulin and who has dealt with insulin resistance from diagnosis to now, I utilize a greater amount of insulin than most other diabetics. And similar to Matt's story earlier, I've also been in the situation where I have had to ration my insulin. About a year and a half ago, I was transitioning jobs, much like Matt mentioned. When you move to take a state of Texas job, their insurance policy has a 3-month waiting period. So of course, I signed up for COBRA because I needed insurance for that 3 months and had to find ways to obtain my insulin. I was privileged to have time to be able to sit down, to research, to find some of the programs that these pharmaceutical companies do offer for those of us with insulin, but the question still remains, why offer the program when you can lower the price? And I think what we must consider as we think about the true price of insulin, especially as someone who has lived life as someone who is Black first, a young Black man first, and as a diabetic second, is even the access to the barrier points of insulin. As a young Black man, I have spoken with other young Black diabetics about barriers even to just getting an appointment with an endocrinologist to get the prescription that is needed to get the insulin, then you bear the cost of the appointment, you bear the cost of getting the prescription filled. And these things are debilitating. And as it was mentioned earlier in the panelist discussion, when we talk about the structure of systemic racism, of course, if it is going to affect people of color, it is also going to affect those who are of lower socioeconomic status. And so we have seen over the course of years, many diabetics rationing their insulin. There have been few that have been reported to have died, but we don't know the total count of that because there's really not that much research going on in the field of diabetes. And so there likely could be many more who have passed away from rationing their insulin. I want to be clear, insulin is something that every human being needs to live, but many of us do not have access and cannot afford access to that vital hormone that allows us to live day to day. I'm thankful for the discussion that has taken place here, and I'm thankful for the opportunity to represent T1 International, an organization whose mission as a board member strive to assist with in ensuring that those around the world can enact policy change needed to get the access to this vital hormone that they need to live. But we in the US need to make this a top priority. People are dying, people are rationing, people are doing things such as trying to cross the border to Mexico to buy insulin over the counter there. And it needs to be addressed. And so this conversation, I am thankful for. I'm thankful to see this happening. We are looking not just for allies in this fight, we are looking for accomplices, those who will sign their name and invest, give up whatever level of privilege that they may have to really join this fight so that insulin can truly be given to everyone who needs it. Thank you.
Thank you so much, Cameron. I just want to close by thanking all of our panelists, Cameron, Matt, Maurice, Tahir, Laura, Alex. It's been kind of incredible, I think, to watch this kind of project turn from a policy idea that Olivia and our team had along with David Toppelberg. We came across Maurice and Aker's paper. Olivia did a lot of outreach and work and connected with this incredible community that has been waiting for relief from public officials for so long. And, we hope that together we can start to provide that. So please go to the website of our coalition, Investigate Insulin Now, sign the petition, tell your story. We are hopeful that, like I said at the beginning of this call, we're at a turning point where there will be enforcers who are eager and willing to take on corporate power, to wield their power, particularly in areas of the economy that exhibit such egregiously abusive behavior. And this is certainly at the top of that list. So thank you again for participants. Thanks again for our audience for engaging in the chat and for engaging with us offline. And we look forward to taking this campaign forward together.